Hello, so my name is Nancy Lopez. I am currently the maternity ward sister at the maternity ward in St. Bernard's Hospital. Well, I started my midwifery career in 2005 after I finished my degree. So that would make it 18 years this year. Within the maternity department, we've got a number of different healthcare professionals. We've got domestics, we've got assistant nurses, we've got enrolled nurses, and we've got staff midwives. Each of these individuals have their own specific role within the department, and they each provide healthcare to all our patients in their own different special ways. The role of the midwife is very diverse. We do begin at the very beginning of the pregnancy, at the very early, when you found out you're pregnant, and it goes right through until your baby is about 28 or 30 days old. We ensure that your pregnancy journey is safe. You come to your antenatal checks, and we make sure that both you and your baby are well. We're there during the delivery of the baby, and we're there to make sure that your transition into parenthood is a smooth one. A staff midwife should be empathetic and should be compassionate. We should be able to have a lot of patience, because there are many challenges along the way, even though we are in a beautiful ward, and we only see joyous occasions. There is the odd and rare occasion where we might have to deliver some sad news or some bad news to patients or service users. So compassion is a key skill that anybody should possess. Good communication skills is another one. Being able to work with different peoples from different lifestyles. Being able to provide and being able to give parents some sort of education. There are different ways that somebody can become a midwife. If you're currently undertaking your GCSEs and you're planning on doing your A-levels, you could go into direct entry midwifery in the university in the UK. Unfortunately, Gibraltar still don't have midwifery as part of their university degrees, but there are many universities in the UK that do provide this. There are other different ways, like for example, if you're not quite sure you want to become a midwife, you could try nursing first and see whether that suits you. And then once you have an established staff nurse, you could go and do like a post-registration degree into midwifery. Now, there are certain differences between this, because depends on the university that you apply to, depends on what they would ask from you and how long this top-up would be. There are universities that that you would be able to do it in 18 months, and there are the universities that would expect you to do the 3 years again. If for any reason you'd rather go through through the college, there is an access for nursing here at the Gibraltar University. You can go into that, and then that will lead you into a career in nursing as well. So if you don't complete your GCSEs, it's not the end of the world. There are other ways that you can get into nursing and midwifery, and the University in Gibraltar does provide for that at the moment. At the moment, I mean, English and maths are a must at the moment. I know that science is preferable. Psychology, I think an A-level in psychology is also preferable, and biology. But there's not a specific requirement. As long as you've got English and maths, if you've passed your 5 GCSEs, if you've passed your 3 A-levels, you should be able to get into a good university. So the GHA have always provided Westside and Bayside students with work experience. I think we've got about 9 students coming to us this summer. It's a roll-on program that happens every year. Some students come in Easter, others come in summer. So if you'd like to join us for some work experience, contact your teachers and they'll be able to arrange this placement for you. It's the helping people. It's the being able to provide care and being able to provide new mothers, new parents with the support that they require, to take this baby home with them. It's the knowing that you've made a difference. It's the knowing that maybe you've helped someone and that you've made something easier a little bit for someone that day. It's your colleagues, looking around and knowing that you've made the department a little bit safer for your colleagues as well. I mean, Gibraltar is a very unique place. I mean, obviously our birth rates are not comparable to the UK. We have about 350 to 400 births a year. So even though you might think that this is quiet and that we're going to be very bored, it's not the case. In contrary to the UK, the maternity ward, we do absolutely everything from here. So we do all the community, we do all the postnatals, we do all the deliveries, and everything is from just this little ward. Whereas in the UK, you are allocated to work in different areas. So here in Gibraltar, you do become a specialist, a generalist specialist, if you know what I mean. We do a little bit of everything. So we know a little bit about absolutely everything. We have a lot to do as well with the community. We have a lot to do as well with social services and youth work. So sometimes a midwife in the UK is not exposed to all of this. So the other big difference between Gibraltar and UK is the fact that we get to see our patients grow, our little newborn babies. So you pop into them in Morrison's, you pop into them down Main Street. Our women are not just unit numbers, they actually have a name and they've got a whole family behind them, and that is beautiful to take part in. And you know, eventually, because you're there for that special day, you kind of become part of that family.